Statistically, like 52% of women in Uganda, they're using bleaching creams. Skin bleaching is now on the trend, or it is one of the, what you call the body changing procedures that is taking place. You want to change your color from 3 or 4 times fold the shade you wear, from dark to lighter. Because of the perspectives we attach to skin lightening and bleaching, we know we look beautiful if you're light. You have more opportunities for jobs if you're light-skinned. Those are the attachments we have. Also, there are other factors. It could be generational. In your family, you've been doing that, bleaching. You've seen your mom bleaching. So you also adopt that trend. It is normal to you. Because of the attributions we attach to people who are light-skinned. Skin bleaching is happening everywhere. More so in Africa. We started in 1950s. Just imagine that trend from 1950s up to now. But of course, the government, since 2006, there was a ban on over-the-counter skin lightening, ingredients containing mercury and hydroquinone, because of the vast side effects it implicates to the people.
Call me Firdaus here. Welcome to our special discussion on the topic of skin bleaching. Dr. Umar, you're most welcome.
Thank you, Firdaus. I'm honored to be on this platform.
Why are they choosing to lighten up or bleach their skins?
Yes, one of the reasons is the campaigns. These people who lighten people, they use role models. Oh, you see, this guy is a role model. This guy used to lighten, he was like this, and now he's like this. He's in this position. That campaign, that propaganda we are hearing is pushing the young folks to lighten. Okay. Then another thing, availability of these lightening creams also. Yes, these things are available without any restriction. Go to Chikubo, you'll find those people mixing creams for people to lighten without any restriction. So what will take place? These people, the things are available to use. So, and they are cheap. But you find others are spending a lot really to destroy their skins. And also you have what you call body dysmorphic disorder. There are people who don't want the way they look. It's a disorder, it's a psychiatric disorder. Me, I don't want this. I don't want to be black. Because one of the stigmatization that is attached to black people. Light-skinned people will address dark-skinned people as not human beings, or people who are inferior to them. If you go to India, India has what you call a caste system, which was abolished in 1950, but even to now it is there. Those with a lighter and brown complexion will appear more beautiful than the rest. Now another thing we are seeing is Korean glass skin, fairer, lighter complexion. That is the trend. I want a Korean glass skin, I want a Korean glass skin. People are forced to lighten to get that, because now that is the trend that is happening.
Is lightening or changing the color of your skin, is it a bad thing? Totally.
It is okay. You have the mandate or the will to live the life the way you want. But do it the right way. But of course, do it knowing the repercussion. You know, those are the problems. You know, I used this, but I didn't know this could happen. I wouldn't have lightened my skin if I knew I would get exogenous ochronosis.
That's why
yes,
you've been invited on the channel, so that people know that they're going to bleach, but this and this will happen to them.
Absolutely. Because in my setting, you see people coming, those at least who know about skin bleaching, they know I want to lighten, but in a medical way. Fine, you lighten, but of course there are repercussions. We have, if you go back to how God created our color, or our skins, we have 2 types of melanin. We have eumelanin and pheomelanin. Eumelanin is that what gives that brown-black pigmentation. And it has its own purposes. One, it reflects the UV radiations. The more dark you are, the more safer you are from getting skin cancers. Okay. But the lighter ones, that when you lighten, you're removing that pigment. Now what is going to protect you? These people lighten without having sun protection. What do you expect? The pigment that would have blocked the UV radiation is there. You're not using any sunscreen or any sun protection. Boom. Tomorrow you come, so I have melasma, I have exogenous ochronosis. My skin is thin. Oh my God. Because of what you used. And the problem...
You mean the skin is thin?
Those are some of the side effects. I think we shall see them.
Okay.
What are the implications or the side effects of these lightening creams? Some is skin thinning. Your skin becomes paper thin, like a polythene, yes. And your skin is the first defense mechanism against the external environment. Viruses, bacteria, the external pressure, all that. Heat, everything will be compromised. These are people who cannot stand in the sun because they destroyed their skin. Oh, the sun is hot, but 2 years ago, 5 years ago, you're fine. You could stand in the sun for 2 hours. But because you lightened your face, you lightened your whole body, now you're facing with these heat intolerances. You're getting continuous infections, you're getting eczemas, things that you did not have. But because you destroyed your first barrier of the body, that is the skin.
Let's go deep into the implications of skin bleaching.
Yes.
What happens if you change the color of your skin?
Let's look at the products these people are using, or the actives, or some of the agents they use to lighten. 1 is mercury, 2 is hydroquinone, 3 is adulterating, 4 is glutathione, 5 are steroids. Among all I've mentioned, mercury, hydroquinone, and steroids are the worst. Mercury is carcinogenic.
First way, I'm not so much into the terms, medical terms. The one thing they tell you in antenatal, if a drop of mercury drops on the fetus, there are disorders. And I've seen pregnant women using mixed creams.
Yes, now that goes back actually to our healthcare delivery systems. These things are not regulated. Go to Chikuwa, you'll find Carolite, but it was banned. A few years ago, Carolite was banned. Products containing mercury, Carolite, they are banned on the market. But you go in the supermarket, you'll find a yellow tin with Carolite lightening cream. And really, so our policy implementation is still down. And these are the problems that you're going to face in the years to come. Kids who are exposed to mercury, you find they have neurological deficits, they have problems, they have issues because of what the mother used. And the common question I find in myself, so I want to lighten, would it have an implication on my baby? Those now are the few. What about these good people who are not medical workers? What will happen? Because they want money. They will say, come, it's okay, it's safe, they will live you. But in the long run, this baby, 10 years to come, you'll get a kid without a limb. Because if we go back, the exposure to mercury is carcinogenic, it alters DNA, synthesis or damages DNA. So there will be a trail that will be left in your family, trust me on that. Then individually you lighten, but still there are what you call physical signs and implications that are going to come on you. 1, change of color. Yes, change of color, and you develop things. That's what you want, yeah. Yes, but people used to know you as a black person. What is it going to create? Social implication. What happened? You'll hear comments where you say, that has a psychological implication. Another thing that will happen, continuous use of things such as steroids, mercury, and hydroquinone has what we call a setback. You'll develop what we call exogenous chronosis.
What's that?
It is locally known as namakula. I've seen people, they are light, but they have what we call black-blue pigmentation.
Something like this.
Yes. Your skin will become thin. Seen someone, but you can see the veins on the skin. You'll develop what we call telangiectasia. These are small veins on the face. You've seen people like spider veins on the face. You'll develop what we call bad acne, steroid-induced acne. You've seen people, you find you've been using your mixed cream, but boom, when you stop, you get very bad acne. These are people who are prone to allergies and what we call irritant contact dermatitis, because the top layer of the skin is being disrupted. So what will happen? You will react to things that you didn't react to previously. People are going to get pigmentation disorders. You'll find Coca-Cola, Fanta, blue, black. Yes. The face is blue, the neck is black. People are going to get what we call skin cancers. People are going to get skin cancers. At worst, people are going to get skin cancers. Because if you go back, people are going to get infections. Steroids, what steroids do? The immune modulator, they suppress the immune system. People are going to become dependent. Yes, and you have other what you call adverse effects. They will get what you call diabetes. They will get hypertension. They will get nephrotic syndrome. But you're fine, but everything stemmed from the using of external lightening creams. Because when you apply this cream, there will be that systemic portion that will be absorbed into the bloodstream, and it will cause these underlying issues. People will develop what we call a fish odor syndrome. People will actually use hydroquinone. They have that characteristic smell. That characteristic, we call it the fish odor syndrome.
Does it go if you bathe and all that?
It won't go away, trust me. But after some time of you stopping, you may get your scent back. But if you had someone, feel like, wow, no, what am chizigo. Yes, we call that fish odor syndrome, but there are very many implications. They have neurological deficits, they affect the nervous system, they are teratogenic in nature. You're applying a cream, but you're affecting the baby because that cream contains mercury. Another thing, these people, they don't know what they are doing actually. The issue is, they don't know.
I find that hard to believe that they
Absolutely. They want to lighten, but they don't know the implications of lightening. And those service providers, those people who give them these products, they also don't know. They want to make money. Or they know and they conceal this information. So
the market is available.
that's what I can tell you. People are doing this. Either they know or they don't know. They don't disclose this information to the people. People who come to my office with these side effects of hydroquinone, this bad pigmentation, melasma, they come. Why did you bleach? What did you use? They mix for me things. Did they tell you the implication? No, so just me. They told me to leave me in my color. I'll get a different shade. But there are very many products they use. They use camphor. They can use Abutine. They can use kojic acid. Now the common brand is Kojisan. Yes, but still it causes irritation, dryness. Those are some of the side effects. Now the common one that really people use is now, the trend is glutathione. IVs, you've heard about IVs, Impiso IVs, Musua IVs.
Is it safer?
It is safe if it is prescribed in a good way or medically. But still, it also has implications. It's like taking Panadol. We always buy Panadol. Panadol has side effects. Also, glutathione has side effects which people don't want to tell people. Yes?
It causes... Just said, and is it done once?
No. To get the tone you want for glutathione, you have to use high-dose glutathione. Glutathione is a drug we use in the management of liver conditions because it is a naturally occurring antioxidant. Your body makes glutathione. Your liver produces glutathione as an antioxidant. But to get the lightening effect, you have to use high doses because that is now the side effect of glutathione. It is a tyrosine inhibitor. It inhibits the conversion of tyrosine to melanin. That is a very long pathway, but just know it is a tyrosine inhibitor. So what will happen? It will reduce formation of your melanin, that black-brown pigment, and you'll turn lighter. So what will take place? One, it will cause, if not used properly. Remember, you're taking in half. One of the implications I'm seeing, people are wasting a lot of money. Because what these people are doing, they're getting few dosages or the normal dosages, which is 600 milligrams. That is normal for someone who has a liver problem because your body, I told you, your body makes glutathione. That is you want, but what you'll see is a brightening complex. People want to lighten. So those who want to lighten will get higher doses, which come with other implications: liver toxicity, renal damage. We have what you call paradoxical hyperpigmentation, paradoxical hypertrichosis. So you're lightening, but boom, you're becoming more dark. So those are the things that really happen. It's fine, but if it's given medically, it's a very safe drug because it's a naturally occurring product. So what I really recommend people, go and see your dermatologist and really find out the information about things about if you want to lighten, if you really hate that color anyway.
These are market women, these are village girls, these are, they don't have that luxury of looking around for information.
So that is the trend that is going place. I told you, these campaigns, these people are going, you've had these things on television, radio, abantu bali mukwera nga atwerusa tulina ebizigo. So those campaigns will help this important figure to maintain her light color. This is what these people are going to pick. Men are lightening as women, abana abato, abakulu.
Wait,
people
did
are
you
lightening.
mention kids?
Not kids, teenagers. If you're a teenager, you're a kid.
So is there a possibility that actually mothers are lightening their children? Their babies. Is there a possibility?
I heard it, but I'm not sure about it. But teenagers, young adults, 20s to 30s, men and women. You've seen men going for IVs on the social media. You've seen them. I'm going to get my glutathione. Then that also, it draws a social implication. It shows it draws a social. People start questioning your identity.
Because what kind of man are you who does such a thing?
Absolutely, but now a man. Anyway, I don't want to draw my negative thought my negative thinking or my thoughts about it. But what I think really, If you want to do it in the right way. Because you as a person, you as Firdaus, me as Umar, I have a right to live the way I want. This is my skin. I can decide. But do it so that you don't disturb us in the future. You know, Doc, I had this, I used this for 10 years now. I have stretch marks. People get stretch marks because of lightening creams. And stretch marks is one of the conditions that is really hard to manage. The elastin is broken and it's very expensive. Now, everything goes back to you. You bought this cream 100,000, 500,000, but I'll tell you the procedure to remove stretch marks is 1 million. And you have to do like 10 sessions, that is 10 million. You'll cry, oh, it's expensive, you go back. I don't have things which remove stretch marks. They will become now troughs in the water. You get very deep troughs, yes. No? Mm-hmm. But everything started from ignorance. These people don't know. Actually, the issues, me really, I will attribute this to ignorance. The people who have lightened very well and they are okay. But still, that one comes with the implication of money. Implication. You don't lighten if you don't have money. So, even if you use injections, you have to have money. Booster dosing, what, okay. Sunscreens.
So once you have the injection, it doesn't end there. You have to boost and...
Absolutely, it's not the end. You have to keep maintaining because this drug, I told you, it's natural occurring, so your body breaks it down. Okay. So after a period of time, you'll go back to Umar. Now you're Firdaus, light, and go back to my dark shade. Huh? Yes, so still, pocket ways is going to be affected. Now what these people resort to, they be like, there's the other woman who mixes for me. That tube, that cream is 100,000. I can afford that every month. But trust me, it is going to come back to you when you're developing melanomas, when you're developing skin cancers. And we tell you, Munange, histopathologist 500 to confirm that diagnosis. For we touch you, we tell you, Munange, you have to do this, you have to do surgery of 5 million. You'll be like, oh, but everything goes back to what we call knowledge and practice. What do these people know about lightening? If it does, I'm requesting, go back and ask, why do they light? If you have time, and bring those people on board and listen to their stories. One of the things they didn't know what they are doing it. Maybe they had some pigmentation because of the sun and they went there. You understand? Because sun exposure can really make people come or develop more pigment, so they'll turn more dark. So those people, they'll be forced to use these lightening creams to clear their tone, not to even out their tone.
Speaking of which, okay, you mentioned that one of the reasons they do bleach, it's hyperpigmentation.
Yes, hyperpigmentation. Post-acne scars.
Is the solution to bleach?
The solution is
like
not...
my skin. Do I
yes.
need to bleach?
No, you don't need to bleach.
Well, how can I restore my skin without resorting to bleaching?
I would recommend go and visit a dermatologist. These are people who are experienced in managing skin conditions.
What if I can't afford a dermatologist?
Consultation of 50,000, really? But now, for us, we shall wait for you at the end of that time. I'm telling you. Because if you look at those things, they don't even have the World Health recommended guidelines of 1 microgram per kilogram of mercury. You find these products, they don't have any percentage of the active that is there. So you're just using something, but you don't know how much of that you're using. So it is coming back to you. Oh, my friend mixes, puts oil, carolite, and now the thing, I really don't know what to say. It's really, really bad, but skin lightening really is. It's not for us, but it's your body. You can do what you want, really. But exactly. One of the things I would tell you, you're spoiling yourself. You're putting yourself at risk of cancers, of becoming more black. Paradoxical hyperpigmentation, you turn more black.
So I know Dr. Umar can talk passionately about this topic. I think we share a similar passion of wanting to treat people since you're a doctor and protecting their health and all that. So you as a healthy worker or someone who is in the medical field, what role do you think you can play, you and others, in making sure that these patients are not misled into skin bleaching or doing it the wrong way?
Actually, that comes back to our policymakers. Comes back to UNBS and the NDA. Are these products on the market safe for consumption? I told you, there was a policy that was formulated of banning all products containing mercury. Carolite was banned in 2006, that's 8 years ago, but now it is there. Go to Chikuba, we won't find Carolite, but it was banned.
Lemon vet.
Now, lemon vet, now that actually, lemon vet is a steroid. It contains a high potency steroid, clobetasol, and you find it a street vendor selling lemon vet. Can you imagine?
I think it's the commonest, is it, you call it a
Skin
steroid?
Success, that's what it is, that small tubes, lemon vet, Skin Success, Movet. How can a street vendor sell lemon vet? How can someone in Chikubo sell Movet cream? It has clobetasol. And they're selling it to people. You want a piece, they sell it to you. These people are going and they mix it in their vaccine. Oh, I'm lightening, I'm becoming fine. This is a steroid. It is like having a wound and you cover it. When you remove the cover, that wound will still be there. This is what steroids do. They mask. You have pimples, you apply your steroid cream. It clears. 2 months down the road, you develop what you call steroid-induced dermatitis. You develop steroid-induced acne. You get ash trial. You get skin thinning because you used something of 4,000. So the issue comes back to we need to campaign about skin lightening. We need to what we call to employ our people with knowledge. Okay? So it could be mass communication, radio interviews, TV mentions. People they should start talking about skin lightening as a very wrong habit. South Africa, actually, in Africa, South Africa has the least people who are lightening their skin because their policies and they implemented these policies.
I saw a clip where their police officers, they were going literally to the shops and supermarkets.
Absolutely.
Find you selling,
you're fined, you're taken to prison because you're putting the public at risk. They give you a very bad fine so that your neighbor will know this is not right. But Nangawa country, Chintu Chidogo, what, and you move on. But that is wrong. That is really wrong. Fine, this person who is bleaching is not your friend, is not your mother, but is someone else's mother. No, someone has to foot that bill.
No, my worry actually, which drove me to look for you, is the fact that if these things fall, if these chemicals fall on the fetus has to suffer the consequences.
Generational.
It's generational.
Yes.
So you're saying maybe it won't affect me, but
your
son will marry that person or your daughter.
Absolutely. That is why. That is what I'm telling you. So these are things our policymakers have to be strict and implement these policies, UNBS and NDA. Because a lot of things, these over-the-counter creams, these creams they paint in beauty stores, these things they mix, they contain mercury, they contain camphor, they contain hydroquinone. Hydroquinone with the unknown percentage. The recommended hydroquinone is 2 to 4%. 2% is over-the-counter. And 4% should be a prescription-only medication by a specialist. But you find these people have hydroquinone-containing products with no percentage. What if you're using 10%? What if you're doing 20%? And another thing I'm encouraging people, don't buy any product that doesn't have any label. Don't buy any product that doesn't have any ingredient. What are you using?
The labels are there and maybe the prescriptions are there and everything. Do they read them?
That goes back to you. Ignorance. We have to empower people with this knowledge, and so that we change their attitudes towards skin lightening. It can be through mass media communication. We have many radios around. TV mentions, DJ mentions. There are a lot of things we can do to change the healthy behaviors of these people.
But it's a multifaceted issue.
Yes, the health workers, people who are selling this, the business people, they should really think about people. I'm selling this cream, what if it is given to me? Now what really actually bothers me, these people who sell those things, they don't use their products.
I visited those cosmetic shops. You find people, they're having your skin, glowing skin.
But they don't use their products.
They're not bleached, they're very fine.
They don't use their products. Yes. They will come to dermatologists and and they are fixed bulungi. I'm telling you facts. When they are fixed, they will go back.
And you see my skin?
Oh, I'm using Carolite. I mix my own. This is a natural glow oil. No. And now social media has really done so worse. TikTok, Instagram, OMG. I'm mixing, this is a natural glow oil, this is a brightening, this is darker corrector. Everything in one tin and use it on your whole body. So what will happen? Using a lightening cream to address, maybe you have a pigmentation, a dark patch, and use it for the whole body. What will happen, trust me, this patch you're correcting will be more darker than the rest of the body. Do you understand? This part will be more darker than the rest of the body because the rest of the body will become lighter than the dark patch. So, really. And this is the trend our children are copying. Our judges are bleaching. Oh.
No, what happens when in families, I've had families, they start comparing children. This one is lighter, this one is darker, and I've seen it.
Stigmatization.
Oh, the other one is darker, the other one is...
Stigmatization. What you're imprinting on this other kid who is with a dark complexion, the brown tone is the source, is the way to go. When this kid reaches 12, 15, atandika okuba ebizigo bya mami, atandika okugamba I need my save her money for skin lightening because awulidde ku mawulire gunda so and so is an expert in lightening. So still we have a very bad, anyway, really I don't know what to say, but it's really, really bad and absurd. And what I would recommend, really love yourself, the way you are. And if I told you that's your body, if I told you want to do it, go and visit a dermatologist, someone who is an expert in dealing with skin. They will discuss with you the different methods of which you can get the tone you want.
Toning and lightening, it's different.
Toning and lightening, those are different things.
Those are different things.
Toning, you have an even tone and you want your tone to be uniform. Yeah. Lightening is changing from one shade to another. And
they lie. Those people who sell those creams, they lie to people. This is just whitening. Whitening is different from lightening.
What is the difference in whitening and lightening? Those are the same things, guys. No, but what they use is brightening.
Oh, yeah. Brightening.
What they use is brightening. But trust me, that is a myth or a misconception that was developed by people who are manufacturing these things. They put brightening ingredients, but you find mercury in that cream. They put brightening, you find hydroquinone in that cream. So it comes back to how you are ignorant about what is going on.
You know, I once, because I've had skin problems for long, so I once visited a dermatologist in a hospital, and then he gave me a cream. I think it was made from Turkey and all that. So when he gave me this cream, I'm not someone who just uses something out of the blue. So I went on the internet and I researched about this cream. I don't remember the real name, but if I remember, I'll share. I saw this cream had been banned in UK, in US, and those countries that care about their people. And then on this cream, they had written, don't use it if you have like a partner and you're expecting to get pregnant or you're breastfeeding. Don't use it. But this guy just gave me the cream.
And they didn't explain you to that?
They didn't explain anything.
Oh, yes, sure. So now, what I really, you as an end user, you as a patient, ask your doctor, you're giving me this. Even if it's Panadol, doctor, on the Panadol, what are the side effects?
Lugezi, they call you a
No, see Lugezi. Those are the patient's rights. And if a doctor is doing that, that is bad. Because the patient has a right to know the side effect and what are the alternatives to that treatment if he or she doesn't want this. Yes? Right. So I implore people, ask your doctors, doctor, you've given me this vitamin C serum. What is the side effect? You've given me Demelan cream. What is the side effect? You've given me this lightening cream. What should I expect? Side effects are the anticipated effects of a drug in the due course of action. Yes? You're using this cream, but you'll you'll feel a burning sensation. Those are expected. But you have what we call adverse effects. Also ask for them. So that if you get this, please come back to me. Stop the drug and come back to me immediately so that we address the pitfall. Okay. Yes? Yes, please.
Wow. So guys, I think you've learned something. Please inform your daughter, inform your sister, inform your mom, your cousin, whoever has plans of bleaching, and if they think they can't avoid, he has given you a solution. Go to the dermatologist. And where we are, it's the...
This is Alma Dermatology Clinic.
Exactly. And I think if I'm going to start on my medication of my face, I think I will definitely entrust my face or my skin with him, because it's really important that we even go to dermatologists who are informed, who know what they're doing. Not everyone actually knows what they're doing. You've seen them around Kampala. There are very many. Those are business and conmen.
My last message to you guys, please, if you can't do away with lightening, visit a dermatologist.
Yeah.
That is what I can tell you, because this person will have that audacity to tell you, you're going to use glutathione, but these are the side effects. So that you know you're going to use this product to lighten, but these are the setbacks. I think that's the beauty with it. Because trust me, every drug has a side effect. They shouldn't tell you, those people, they have very many, they call them IV parlors now. Everyone is giving glutathione, but they don't know how glutathione works. After giving glutathione, they mix for you a chizigo. You think the glutathione is the one that is working? Kumbe the material that they gave you. That is what these people are doing. You pay wholesomely for the injection, and they give you the chizigo. No, this is a bonus for us. But you think the injection is that, kumbe the chizigo that I've given you, that mixed thing without anything. Narco corrector, spot corrector, glycerin, hydrogen. Like 10 things they mix in a bucket and they give you. Another thing, those things were made separately in a laboratory by the Firdaus. Someone will make glycerin separately, someone will make abutine separately, someone will make kojic acid, lactic acid separately. But there are standardized tests they do in laboratories for these things to come together, to use these actives together, so that they don't hydrolyze each other, they don't oxidize each other. Because if you hydrolyze, let's say, abutine, alpha-abutine, if it is hydrolyzed by an alkaline medium, it will turn into hydroquinone.
Wow.
And this is the common thing that we use, alpha-abutine. Higher abutine solution serum, someone will mix a serum with an alkaline solution, an alkaline ingredient. So, you see, they will tell you alpha-butene, but you're lightening yourself. You're getting, actually, because you're getting dark, because now it was hydrolyzed into hydroquinone. So make sure these products were made in a laboratory, the single ingredient. Okay?
How many laboratories do we have in
Uganda, I don't know, but what I'm telling you, they are there, of course. They are there. There are authentic people who are doing good things in Uganda. Yes. There are few, but they are there. But the issue is these people, these people who mix creams, they will get 10 actives and add them in one tin. But those things are hydrolyzing, they're changing the pH of each other. Instead of getting the benefits, you're getting actually very bad side effects, setbacks. So please, skin lightening, actually you should do away with it. But I told you, this is your body. If you want to, visit a dermatologist and have a comprehensive discussion about your skin lightening journey.